Okay, hello, it's Dr. Buford. We're just getting our first look inside your right shoulder. Camera's coming in from the back. That clear cannula you see is coming in from the front. You're laying on your side in what we call the lateral decubitus position. Just means you're laying on your side and your right arm is pointing straight up in the air. And as a result, the humeral head is that structure you see at the top half of the screen. You kind of see the curvature of the ball. And the glenoid, the socket, is down below. This is all the glenoid. So right off the bat, we can see you've got some arthritic changes where the cartilage is no longer smooth. So what we're seeing here is an actual type 2 slap lesion. So as you look at the biceps tendon as it exits the shoulder, that looks okay at the top of the screen. To the left of that is the supraspinatus tendon, and we can see that this looks nice and smooth, and the attachment of the supraspinatus inserts into the humeral head, and that looks like a normal attachment. As we look down, we can see where one of the problems is. This is all torn, and this is a true type 2 slap lesion where the biceps tendon itself is okay, but this area here is loose. And so we'll take a probe. That's fine. This is what we call a crochet hook coming in, this little gold instrument. And as we pull back on this anchor, we can see how this is lifts up and is loose. The problem with just trying to glue this back down is that it doesn't have a good blood supply. And you can see that there's articular cartilage all the way down over the superior edge of the glenoid. And so the soft tissue is not going to heal just back to the articular cartilage. So if we're going to repair this in this part of the shoulder, we have to remove the cartilage to get a good repair. Now, the reason why we talked about doing something different in your shoulder is because we know the blood supply is not great in this area as we age, and we have a different procedure that gives us a higher success rate, in my opinion. So we're going to clean this up in just a minute. We're going to cut the biceps, and we're going to do what's called the biceps tenodesis in a different part of your shoulder. Okay, so now I have a pair of scissors. We're going to release the biceps here. And then, like I was saying a minute ago, we're going to do a biceps tenodesis and reattach the biceps in a different part of the shoulder. So now we've released the biceps. Put that cannula back in here now. And now we'll put in our shaver. Hold the camera. We'll keep working here and show you some more in a minute. Okay, so just smoothing out this area, you can see the biceps tendon's been released, so it can no longer cause a problem. And now we're going to go ahead and finish debriding this labrum. Without the biceps tendon distracting it, this will be fine. And so, hold the shaver. We're going to rotate the camera here, and here we can debride a little bit of the articular cartilage here, and a little bit of this labral tear. And this is what early arthritis looks like in the shoulder. So we will keep working here and show you more in a little bit. We've been debriding this posterior labrum. It's certainly meniscoid in nature, as you see here. I don't see any need to debride anything further. We don't want to remove any more tissue than we have to, just to get rid of any mechanical symptoms. And I think that looks pretty good. Back here, there's no specific ligaments that attach to the labrum. Kind of in this area where we're working right there. So I think we're okay here. So I think the next thing we'll show you will be our work in the subacromial space, just having a look at any bone spurs and at the rotator cuff from that side.